a state grant. I'll turn it over to Ms. Clemens Johnson to tee this one up for us.
Thank you, Chair Albernos. You said the long, difficult name of the grant. But in general, it is a home visiting expansion program tagging on to the Babies Born Healthy program that the county has had since FY19. The staff was gracious enough to come over to provide more information about the Babies Born Health program. But again, this is just a supplement to the work that we're already doing. Currently, with our staffing and capacity, the program is able to see 140 patients a year. And I believe this will increase it to 70 additional at-risk pregnant women each year. And just in general, the Babies Born Healthy is a grant focused on high disparities in infant mortality rates. It is funded across the state, and fortunately, the county is a recipient of those grant funds. The focus of the program is really on care coordination to help in providing those services to help at-risk pregnant women. And this program, in particularly Babies Born Healthy, is focused on women in the zip codes with the poorest birth outcomes, which are 20902, 20903, 20904, 20905, 20906, and 20912. So I will end it there and see if there are any comments from our colleagues in HHS. Thank you.
Thank you so much. Dr. Rogers?
Yes, good afternoon. Thank you again. I'm actually going to turn it over to Becky Smith, our Senior Administrator for Maternal and Child Health, to provide some opening comments.
Great, thank you.
Hi, how are you? I'd like to also introduce Angeline Bell. She's our Program Manager for the Babies Born Healthy program. So yeah, as Tara said, we've been around, Babies Born Healthy's been around for 5 years. We were actually selected by the state as one of 7 counties to provide that program when they gave us the money initially. Because of our high disparities. And then we found the opportunity to apply for this home visiting expansion project. It was delayed and turned around and changed, but we finally were awarded the money and we're thrilled. And it will do that, just as Tara said, it will allow us to expand the program from, 2.5 full-time staff to 4 full-time staff. We're going to add a health educator who will also hopefully can also do nurse lactation work. Or not nurse lactation work, just lactation consultant work, and add another part-time nurse to again allow us to expand the number of people we see.
I'd also say, because I noticed in the packet that council staff noted about the African American Health Program and the SMILE program and that important relationship and collaboration between the Babies Born Healthy program and the SMILE program. So let me just ask Becky to just talk a little bit about that partnership in anticipation of any of the questions that you may have.
Sure. So there's 2 programs. The SMILE program has been around, I'm going to say 20 years. It's, I think, started right around the time I started here at the county. And they serve African American women of any insurance, any socioeconomic rate, any zip code. So pretty widespread. And their program was actually initially targeted, I think, more towards the middle class, educated African American woman, but they now have expanded to see anybody. SMILE, no, that's SMILE. Babies Born Healthy, which is who we are here about, is a little bit more structured in on our acceptance. We only accept African American women on Medicaid, or at least we say we only target those women. So but basically all of our women are enrolled in Medicaid and then live in those high-risk zip codes. So there's vast differences. I mean, there's actually way more than enough women for both our programs to serve. In 2020, we had, that's not a number. Oh no, 2020, I have to do the math. Okay, I'm not going to tell you how many African American women were born in 2020 because I'd have to do the math. But I can say if you just look at our high-risk zip codes that the Babies Born Healthy program serves, women on Medicaid, there's about 1,500 women that would be eligible for our program, and we can see what, if we get this expansion, 170. I think SMILES can take, are they 150 a year or 200? Yeah, that's so there is no want for patients for both programs to serve. And we also coordinate with them from the start. They were involved in the planning of our Babies Born Healthy program. We work closely with Arlie Wallace as we wrote that grant. We participate in the quarterly community action team together. That's a team that's goal is to reduce infant mortality. We're all on that committee together. So I think we work closely with them. We know what the other program is doing, and I think, can coordinate services well to make sure we're both doing our work and doing it well.
Thank you. Dr. Rogers, did you want to add anything? Okay. I'll just note our African American Health Program has been actively engaged and very supportive of this initiative. I want to thank them for their continued leadership in this and so many other spaces. Did colleagues have any questions or thoughts? Councilmember Lukey, followed by Councilmember Sales.
Yeah, I just wanted to highlight again this morning, radio timeliness on the drive-in, highlighting the maternal morbidity numbers, and it's hard to listen to. And it's hard to think, and they're like, and now we're down to 700. It was like 1,200 in 2021, and presumably it was so high then because there was a lack of maternal fetal care during the pandemic, where people were afraid to engage appropriately and did not seek care or had no access to care because everything was out of whack, even more so than usual. But it's hard to sit here in 2023 and think that should be okay in any way, shape, or form, given where we are with medicine and technology, and yet we still have these access gaps. So I truly appreciate the work of the program and the folks that you're serving, and not just the mothers but the babies as well. So thank you.
Thank you. Councilmember Sales.
Thank you, Mr. Chairman. I see that currently there are 140 patients are being served currently, and then this money would go towards 70 additional patients being served. Do you have the breakdown of the racial makeup of this population, of this 140 patients?
They're 100% African American.
Okay.
We're Black African American.
Okay. And so there's another program, the Maternity Partnership Program.
Mm-hmm. That's also out of our shop.
Okay, so that program, it looks like 1,362 participants are participating and identify as white. 1,362 participants are enrolled in that program, with 62.6% identifying as white and only 3.8% identifying as black. And so how much money is being spent on this maternity partnership program? What's the budget?
So let me start by saying that's one of those race and ethnicity are different. So about 95% of those women are actually Latina, Hispanic. And so those women write down on the forms that they're white often. So, and that program is only for uninsured women in Montgomery County. So it's basically for women who aren't legally residing in the county. They don't have their papers. New immigrants that are here. So I think that's why they are what they are. We have most of the immigrants that come to this county are from Latin America, not from other places. We do have the percentage of African Americans or black that you've mentioned are probably they're Haitian Creole or they're Jamaican. We have some African, but not nearly as many as we do Latin Americans. Mm-hmm. The budget for the program is hard to, I don't know, Danny, you might have that number. I can tell you how much money we pay to clinics for prenatal care for that program. I don't actually know what we pay just for staff, but it's high. It's a 1.2 million that we pay to the clinics. But also, can I talk about Healthy Families Equity now? Would that be a... Yeah, just so the Healthy Families Equity Act, which the state passed, which is going to provide prenatal care to women regardless of their immigration status, is going to make most of our maternity partnership patients, or at least we hope, become eligible for Medicaid. So at that point, we plan on expanding our regular home visiting services to anybody who's at risk. So our hope is to start a triage team or a screening team. So we call every woman, we ask them the questions to find out what their risk factors are, If they're high risk, they get assigned a nurse. If they're medium risk, maybe they get assigned a community health worker. If they're no risk, we'll call them again midway through their pregnancy to make sure they're still okay. So we are planning on having our services be spread out among the whole population, and again, equitably based on risk factors.
Yeah, because regardless of the education level, Black women still have the highest maternal child
Absolutely.
Disparity rate. And so, you know, just thinking about the resources that are already being expended on the maternity partnership program, and it just seems like there needs to be maybe a reevaluation of how we are capturing data, how the application is created to screen patients who are eligible to participate in this program. And yeah, I'm just
No, I'm with you. And we've been talking about this for a while. I mean, it has been very important that we do provide prenatal care to the uninsured women, because otherwise there's nowhere else to go. The women we
Yeah.
don't serve that are low income and probably perhaps high risk, I shouldn't say at least have Medicaid, because I don't mean that. They're lucky enough, fortunate enough to have Medicaid, so they are eligible for prenatal care, and they do have somewhere they can go and have it be actually no cost to them. The women that are uninsured in Montgomery County had nowhere else to go. I mean, I shouldn't say that. They could go to Mary Center. That's the one clinic we have that provides prenatal care to uninsured women. But it's a pretty high out-of-pocket cost. Mary Center can't afford to do prenatal care for all of those women. So the maternity partnership really was a savior to that community, especially when it started about, I always say 30 years ago, I think that's right. And that was actually before Mary Center was in the county either. So there was really nowhere to go for free care. And now there's a little bit more, and we're very pleased that CCI, I think, is going to be starting to offer, Community Clinic is going to be offering prenatal care soon as well, which will increase the places people can go. But the maternity partnership has been very valuable in providing prenatal care. But you are very right that some of our other services, such as our case management, our home visits, I think it's time that we spread them out, again, based on risk and not just based on insurance status.
yeah, I'm just hoping that the data that comes back, we have a better understanding once the Healthy Babies Equity Act, I guess, gets more underway, that we better understand the data and, you know, who's actually being served, and making sure that these resources are going to the population. I mean, seeing that 143,000 is for personnel, I'm just wondering what are our impacted populations getting from this?
Angeline, do you want to talk about
What are you providing?
for Babies Born Healthy?
Yeah.
We do provide not just case management and care coordination services. Those are home visits that are done throughout the pregnancy. But the good thing is that we also provide social support. As was mentioned, like during COVID, many of these moms they were scared to go to the doctor's office. So we had virtual sessions, and it was really good social support for them. A lot of activities, community activities out in the public. You know, during COVID, we would meet at the park and do wellness walk, you know, to keep them healthy throughout their pregnancy. Talk to them, make sure they keeping those doctor's appointments, letting them know it's important to go to those doctor's appointments, and that they're eating well, eating healthy, taking their prenatal vitamins. So we do offer a lot of social support for them, which is good.
Good. So out of those program participants, do we have a number of, was it 100% success rate on the babies that were born healthy?
100 out of the 140, we had we had 90%. 90% were.
Is that a guess,
I mean, if
or
we saying
you
born
have-
healthy, it's 90% that were born at normal birth weight.
Yes, exactly.
Yes, about 90% were born at birth weight, and we're not preterm, what we call full-term birth weight.
Okay.
We had a very good success about introducing them to breastfeeding at birth. And then even again at 6 months, we still have really good numbers of that. babies who are keeping their well visits as well, and up to date on their immunizations as well. So we had very good success rate.
And then how long do you track the babies after birth?
And 6 months.
Okay.
6 months.
All right. Thank you, Mr. Chair.
Good questions and good points. So the issue of the collection of data and demographic data specifically is one that we really got to tackle. So because it doesn't tell the whole story. Now, some of what we track is dictated by what the federal grants are that we receive require us to track. But I think even within that framework, there's an opportunity for us to go deeper, to more complete the story and to put us in a better position to deliver the services. So I think this is a lot more work to come, but Councilmember Sales and Councilmember Lukey's points are well taken. So, Dr. Rogers?
Yes, just consistent with the HHS committee work session that we had a few weeks ago, the department is currently evaluating our healthcare for the uninsured programs to include our maternal child health programs, and we have committed to working with your offices on that transformation. And so we will be in touch to include better ways to collect data, evaluation. A lot of the points that you all are raising right now, I'm noting, so that when we do engage with the offices, we can make sure that we more effectively align and address the challenges, the issues, so we can better serve our residents and produce optimal outcomes.
Yeah, and there's lots of different ways we need to tackle this. The fact that Mary Center is one of the only clinics that provides this particular type of care for the undocumented or the uninsured is a problem. So it's because not everybody can get to their wonderful locations. If you live in the upper part of the county, as an example, it's very difficult to access. So there's a lot more work that we're going to do, but we're going to do it together. And I'm very excited about this incredible committee. So I think without objection, then, we will move this to full council. Is that okay? Okay, great. Great. Thank you all very much. With that, this committee session is adjourned.